So a tubal ligation is a surgical procedure that we perform to remove the fallopian tube to prevent pregnancy. So there are several different ways that we can tie your tubes. The most common form that we use nowadays is called a bilateral salpingectomy. So this is a laparoscopic surgery, which is minimally invasive, and we go inside your abdomen and we remove your entire fallopian tube. This has the highest success rate, but is not reversible because there's no fallopian tube left. So that's the type that we perform the most often. The other forms are either partial salpingectomies, where we're removing just a portion of each of the fallopian tubes, or then there's occlusive types of tubal ligations. That's where we put little clips on each of the tubes. So those are kind of the main ways that we can tie tubes nowadays. So if we do a bilateral salpingectomy, so they remove the entire tube, it is as close to 100% effective as you can possibly get. The other two types of tubal ligations do have a higher failure rate, which is why we do the full removal of both tubes. So the best candidate for a tubal ligation is anyone who does not desire any more or any pregnancies at all. For the most part, that is someone who's over the age of 21 if you have Medicaid, and then anyone who just doesn't want to have any children. So if you have a bilateral salpingectomy where we remove the entire fallopian tube, this is not reversible. There's no tube left to put back together. So if you do want your tubes tied and you have a bilateral salpingectomy, you have to understand that this cannot be reversed. If you've had a tubal ligation in the past where they only removed a small portion of your tube or had a clip applied, those can possibly be reversed, and we do have surgeons who perform those surgeries. But if you're currently considering a tubal ligation, you have to consider this non-reversible. So we have what we call LARCs, long-acting reversible contraception, that work very, very well but can be reversed. So these are great options for someone who does not currently want to have a pregnancy but may in the future. So these include Iuds or Nexplanons, and we place those in the office. So I think if you're considering getting a tubal ligation, the first step is to talk to your OBGYN. You can make a specific appointment for a tubal ligation consult where you can sit and talk to one of our gynecologists about the procedure, if you're a good candidate for it, if you might be interested in another option, or if you're certain that you want to move forward and get the surgery scheduled.